Everybody, no matter what their body type, deserves to be treated like a human being, and they deserve adequate, attentive, appropriate health care. If you disagree with that for any reason, if that makes you want to say, but, well, wait a minute, maybe they should, go ahead and exit stage left. Much appreciated. Bye. What's up, baddies? It's your girl, Brandy Nikhil, and welcome back. So today I want to talk to you about something that I know about personally as well as academically, because this is a big part of the research that I'm doing for my dissertation for my doctoral program. And I want to talk to you about fat phobia, specifically in healthcare settings. And so what I want to talk to you about is how to have conversations with your doctor as a fat Black woman. So intersectionality is important, and that's going to be where all of your identities intersect or meet. And so not only am I a woman, but I'm a Black woman. Not only am I a Black woman, but I am a fat Black woman. You can interchange the word fat with whatever you desire: plus size, super thick, obese if we're talking about the BMI scale, which is racist, but we can talk about that a whole nother time. So there's lots of different, verbiage that you can use for it. Call it whatever you like. But that intersectionality is really specific, especially as it relates to healthcare. And there's a lot of biases that are often experienced in healthcare settings due to that intersectionality. Black women have poorer health outcomes than other demographic groups, and those who are deemed obese based on the body mass index or the BMI also experience a lot of medical neglect based on that particular number. And so I just want to talk from the perspective of a fat Black woman about how I go about talking to doctors to ensure that I'm getting the best possible care. So first things first, being weighed at the doctor. So nobody really likes that, I don't think, whether you are considered fat, obese, or whatever. Most people don't like that part of going to the doctor. So you can decline that. So you can decline it, especially if it is not relevant to what you're there for. So you can say, hey, is this relevant to my visit today? If not, I'd like to skip it. A lot of times they will push you like, oh, okay, well, really need to get your weight or whatever the case. And totally up to you on how far you want to take, the pushback. But you can also ask for a blind weight. So, hey, I don't want to see it. Please make sure it doesn't show up on my documentation after. I don't want to know the number. But you can push back and say that you would prefer not to be weighed in this appointment. Keep in mind, like, this is your appointment. This is your health. This is your insurance. Like, you don't have to be weighed. So that's first thing. But typically, I don't care about that. Weigh me, whatever. It is what it is. You can look at me and tell I probably am not a friend of the BMI. So I'm not concerned about whether or not I'm weighed at the doctor. But what I am concerned about would be when I'm coming in with a specific problem and that problem is not being addressed because of weight. And so here are a few things that I do and or say when I go to the doctor to make sure that my actual health and the problem that I'm presenting for is being addressed appropriately. So, doctor says, so Miss Brandy, according to the BMI, blah, 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 Dr. Lingo. I say, yes, that looks to be about right. However, that's not what I'm here for today. The problem I'm here for today is, if they bring it back up, I hit them with it again. Totally understand that you're seeing that in my chart, but again, that's not what I'm here for today. Could we please discuss what I came in for? What my chief complaint is? The reason for this visit? Is my weight relevant to the reason that I'm here for this visit? If I were not in the obese category, if my BMI was normal or average, will we be having this discussion about my weight? And mind you can say it just like that. You don't have to get loud. You don't have to be belligerent. But you want to continue to emphasize, hey, I'm aware what the scale says, but if this is not the standard course of treatment, if it does not have to do with my weight, let's please focus on the topic at hand. Second scenario. Okay, Miss Brandy. Well, I hear you when you say that your leg is broke, but I'm looking at your chart and I think we could fix this if you just lost some weight. I understand that the chart says what my BMI is, but the fact still remains that my leg is broken. I'm in a lot of pain. Can we please address that without discussing my weight, please? Now, finally, you've tried all of these methods, and the physician, the caretaker, not the caretaker, the physician, the care provider, the clinician is still unwilling to treat you outside of discussing and or trying to remedy your weight. Okay, great. Thank you for that. Could you please go ahead and document in my note and print it off for me before I leave here that you're refusing to X, Y, and Z, whether that's you're refusing to order the test for me, you're refusing to order an x-ray to take a look at what I'm telling you is the problem. Whatever it is they are refusing, ask them to document it explicitly in the note that they are refusing your request and print that note out for you before you leave the office. This is going to hold that provider accountable. If you take that documentation, you can escalate that to wherever it needs to go. You can reach out to the higher ups at the organization that they work for, and you can show proof that you were denied service. You were denied treatment. And I'll tell you my experience. This is just my experience with this. I have never asked for that, and the provider did not change their tune. Now that's very unfortunate because that lets me know that you were displaying a certain level of fatphobia, but when it came to the point where I called your bluff and I said, hey, well, you're gonna have to be accountable for this, then they changed their tune. But I have never said that and had the doctor say, okay, I'll document that I refused it. They'll always say, okay, well, I'll order it for you if you want, but I just don't think it's gonna be helpful. Keep in mind, this is your health here. You know your body. You know when something is not right. Do not second guess that. And if you need care, if you need healthcare treatment, then that's simply what you need. Don't let them discourage you from getting that. Do not let them keep you from getting that. I don't care what a scale says. I don't care what a BMI says. You deserve to be treated like a human being, like every other human being, whether you are underweight, at what they consider ideal weight, or overweight. You deserve proper care. Over and out. Until next time, guys. Bye.